rehab to home. We had some exciting things happen in this area. So, Brad, can you tell us a little bit more about that?
So, Rehab to Home is our program of a skilled stay within a hospital that allows you to receive additional rehabilitation services or nursing services. So, I always tell everybody, sometimes you're just not quite ready to go home. You've gotten all of your acute problems taken care of. You're no longer necessarily at risk for a major problem. However, you're just not quite back to your old self. The Rehab to Home program is a way to stay in the hospital to get that additional care, physical therapy, occupational therapy, speech therapy, additional nursing care. If you have certain types of medications that require administration through IVs, those types of things, and get better so that you can go back to your home, right? All of our goal should be when we get into a hospital is to get out of it, right? We all want to go home or back to whatever that setting was before. If you live in an independent living or assisted living facility, that's where you want to go. If you live at home, that's where you want to go. Swing bed programs have a much higher rate of returning you to that setting compared to going into a long-term care facility. Now, that doesn't mean that there aren't wonderful long-term care facilities. They're just different. So our Rehab to Home program is a program that we keep you as little amount of time as possible to get you back to being independent, walking in the way you were before or moving in the way you were before so that you can go home safely. I've been here for nearly 20 years. Our maximum number of Rehab to Home patients in the past at any given time has been 5. This week we just exceeded that by 3, and we have 8 Rehab to Home patients. That is a substantial improvement in that program over the last many, many years. We're thankful to the community. We want the community to continue to remember to reach out to our team here and ask if that's an option. Whether you're at Woodlawn Hospital and need to stay a little longer in our Rehab to Home program, or you're coming from a larger hospital in Fort Wayne, Indianapolis, or South Bend, and you just need a little extra rehabilitation, think of that program first. It has a much higher success rate in getting people to return home independently. It also has a much higher rate of preventing falls, hospital readmissions, and those types of things. So we're very happy with the team. They have spent a lot of time. Krista, the marketing team, all of our case managers and the nursing teams, making sure that we identify those patients who could use a little additional assistance. Because really, when we do send you home, we want you to stay home. We want you to be healthy and comfortable,
Right.
and we don't want you to have to continue to come back. And so it's really important, I think, in our community to make sure we let everybody know that Rehab to Home program exists.
Well, and I think another thing I just want to reiterate is that you don't have to be at Woodlawn to have that program. You could be at another big hospital, regional hospital, and you can have that program for you. You just need to ask your case manager or the social worker or the discharge planner. They have different names within facilities to call us for the Rehab to Home program, and they should be happy to do that. We've been definitely working this past year to make a lot of partnerships with our healthcare bigger organizations so that we can bring people back home to get better. So we're excited.
Yeah, it's not only better for the patients, it's better for their families. The decreased need to travel to a larger, community, the cost of that travel, the time of that travel, being able to spend time with your family when they're in the hospital is important. If you can get them back home, you got a much greater opportunity for that time to happen. So,
Absolutely.
very, very happy about that.